There were 1,259 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 p.m. last night, and 2 overseas reported cases. There are around 234 cases in ICU, and they vary across all age groups, reflecting the fact that COVID is a severe disease for all. Of the people in ICU, we have 234 and 185 people are not vaccinated. Again, this is not to call out those that are vaccinated from those that are unvaccinated, but it is to reassure the community that vaccines are effective, and it is important that everyone takes this opportunity with increasing supplies, particularly through general practice and pharmacy, to get vaccinated. Sadly, we have had the death of 12 people, and my condolences to their families, 7 women and 5 men. These people were a range of ages, reflecting the severe impact this disease can have on all members of our community. There was a woman aged in her 30s from southwestern Sydney, died at Royal North Shore Hospital, and she had underlying health conditions. We're also reporting the deaths of 2 people in their 50s, 3 people in their 60s, 3 people in their 70s, 2 people in their 80s, and 1 person in their 90s. Of the 12 people who sadly passed away with COVID-19, 10 people were not vaccinated, 1 person had received 1 dose of COVID vaccine, and 1 person had received 2 doses. This was the gentleman in his 90s with underlying health condition who died at the Westmead Hospital, and he acquired his infection at the Hardy Guildford Aged Care Facility. In terms of sewage surveillance, we have found our sewage surveillance incredibly reliable in giving us the early warnings in relation to cases. And we have had sewage detections in Young. And I can report today that we have identified a person who spent time whilst infectious in Wagga Wagga, Young and Mudgee. I call upon all of those communities to be vigilant for symptoms, and our website, New South Wales Health website, will be updated with contact and exposure venues. But it is very important, given we have had those sewage detections in Young. We have now confirmed that through that testing increase in that site, that we've identified a person who has been infectious in that community. In terms of the overall pattern of the disease, we are seeing pleasingly some stabilisation in the local government areas of concern and some downturn in some of the local government areas. I can't re-emphasise the Premier's comments. We need to continue to adhere to the public health orders. We need to stay with it. We have to make sure that we drive home the declines we're seeing, so that we get to the lowest possible level of community transmission of COVID. We need to push those vaccine coverage levels. So I'm internally grateful to the residents of southwestern and western Sydney who have presented for vaccination. But I urge you to be one of the most highly vaccinated populations in the state. So yes, you've achieved 80% in some of your local government areas. Yes, you've achieved 90% in some. I'm challenging you to even push further. So please come out and get vaccinated and get that first dose and get that second dose as soon as possible. Thank you.